दुर्गे स्मृता हरसि भीतिम् अशेषजन्तोः स्वस्थये स्मृता मतिमतीव शुभान् ददासि दारिद्र्यदुःखभय हारिणिका त्वदन्या सर्वोपकारकरणाय सदार्द्रचित्ता सर्वमङ्गलमाङ्गल्ये शिवे सर्वार्थसाधिके शरण्ये त्र्यम्बके गौरी नारायणि नमोऽस्तुते। शङ्खं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनम् मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्।
नमस्कार, गुड इवनिंग टू वन एंड ऑल। आज के इस विशेष सत्र में आपका स्वागत है। आज का ये हमारा विशेष सत्र है आयुष दर्पण फाउंडेशन का जो 8वां फाउंडेशन डे हम लोग मनाने जा रहे हैं और इसी के उपलक्ष्य में हमने इस सीरीज का सत्र का आयोजन किया है। हमारे साथ है डॉक्टर अनुरूपा एचके मैडम। आर यू देयर मैम?
Yes, ma'am.
Yes.
Yeah.
Okay, ma'am. So welcome, ma'am. Welcome on this platform. And I welcome all the delegates, all the participants, doctors और कुछ लोग जुड़ेंगे। तो ये फाउंडेशन डे के उपलक्ष्य में हमने इस सीरीज का आयोजन किया है। आज का ये हमारा फर्स्ट सेशन है जिसमें हमारे साथ है डॉक्टर अनुरूपा, हु इज प्रोफेसर इन रसशास्त्र डिपार्टमेंट इन गवर्नमेंट आयुर्वेद मेडिकल कॉलेज। So I welcome madam on behalf of Ayush Darpan team, and today's topic is गंधक कल्पा। आई थिंक गंधक कल्पना बहुत ही इंटरेस्टिंग टॉपिक है जिसमें गंधक कल्पना किस प्रकार से अलग अलग जो भी गंधक की कल्पनाएं हैं उसके जो भी कल्प बनते हैं उसको किस प्रकार से यूज किया जा सकता है, इसको लेकर आज का ये हमारा चर्चा सत्र रहेगा। मैडम पहला अपना प्रेजेंटेशन देंगी, उसके बाद हम लोग डिस्कस करेंगे। सो वेलकम मैम एंड यू कैन कंटिन्यू विथ योर सेशन।
Thank you, madam. At the outset, I want to thank the Ayush Darpan Foundation, especially Shilpa Verma madam, for this opportunity. And good evening, one and all. Shall I share my screen, ma'am?
Yes, ma'am, please. It's live on our Facebook page also, and our doctors will join within few minutes.
Okay, slides are visible, ma'am?
Yes.
Can we start?
Yeah, okay, ma'am, continue.
Okay. Today's topic I'm going to discuss at present is with the usage of Gandhaka in different dosage forms. I had taken this Gandhaka because I had even quoted it as a glorious drug. Why? Because Gandhaka, it is, you can see its maximum usage in the Rasa Shastra next to Parada, because you know Parada, it is the core element for the Rasa Shastra. In many of the formulations, most of the formulations of the Parada, we can see the Gandhaka. So it has been mentioned in, though it has been mentioned in Uparasa, in all the Rasa Granthas, it has given its importance as an Parvati Rajan. So with the Shiva Virya, what the Parada has been considered as, Parvati Raja is very important for the any types of action. So we can also see the individual usage of Gandhaka, not only along with the Parada. We can use Parada in different forms. We can use it directly, that is in the Shuddha Gandhaka, different forms like Gandhaka Dhruti, Gandhaka Taila, Gandhaka Rasayana, Malahara. So in various forms, we can use this Gandhaka as well. So that's why we will discuss about these different forms. So before that, we shall know about what actually this Gandhaka. So it's all there in the Rasa Shastra, all studied in second BAMS, but still I just want to brush up about this Gandhaka. Why this Gandhaka has been used in most of the Parada formulations? Because it is an antidote for the Parada. Though Parada has been subjected to various processing, like various samskara, various shodhana, many other processes, still we can see some of the it may be the mild or it may be the more some side effects. So that whatever the untoward effects will be counteracted by this Gandhaka. So that's why in most of the formulations we use Gandhaka. And even there is a huge classifications for this Parada Kalpas in Sagandha and Nirgandha Kalpas. So this Sagandha Kalpas are nothing but the Parada Kalpas with the Gandhaka, and Nirgandha are without this Gandhaka. So it has been advised to use these Nirgandha Kalpas very cautiously, because there is no Gandhaka for counteracting the Parada untoward effects. And even the dosage also it very less. And it has been advised to have a very strict patya. Of course, patya is advised for all the any disease conditions or while administering the medicines, but still in Nirgandha Kalpa, it is a mandatory, you should fix to, or you should strictly follow all the Patya Kalpas. Because these Nirgandha Kalpas, they may produce any side effects because no Gandhaka is present in that. Only few Nirgandha Kalpas are there, like the Pushpa, Rasa Karpura. But these Sagandha Kalpas with Parada and Gandhaka, we can see a lot more formulations, even simple formulations of Parada like Ananda Bhairavaras or this Tribhuvan Kirtiras or Aragyavardhini. So all these Kalpas, it contains Gandhaka along with that. And also you can see the maximum usage of this Gandhaka next to the Parada. So Parada is a drug where you can see the maximum preparation. So if other than the Parada, next comes the Gandhaka, because if it is using along with the Parada as well as in the that is as a single drug we are using it. And we want to do Murchana or the Marana to any of the Rasaushadhi, especially Parada, it has to be subjected for the Murchana to make it or to imbibe the therapeutic quality to the Parada. So this Murchana will be done by again the Gandhaka. So Parada or Rasamurchana done by Gandhaka is considered to be effective, more effective and of less toxicity. And Marana of other metals and minerals, like many of all the metals like Tamra, Loha. So those are very hard and difficult to prepare the bhasmas. We need to add the Gandhaka. Only when Gandhaka is added to those Lohas, it is easy to make it a bhasma. And not only for the Parada, Gandhaka is also an antidote for Naga, that is the lead. This also acts like an antidote, and any side effects or any untoward effects is if observed due to the any toxicity of this Parada and Naga, Gandhaka is advised along with the milk. And not only in the Rasashastra or in the Ayurveda, you can see the usage of this Gandhaka. Even in the modern science, you can see the usage, that is many sulfonamides, that is in antibiotics and even in the antifungal and many of the drugs, you can see the sulfur usage even in the modern medicines. And also it has been called as nature's beauty mineral, because not of its outfit or outside, it's due to increase of the beauty, like it is mainly concentrating or main effect over the skin, even in the hair. On all those things, we can use this sulfur. That's why it has been considered as a nature's beauty mineral. And also, this is a major element in the body. That is the third largest predominant mineral, that is other than the calcium or next to calcium and phosphorus. You can see the maximum present content of this sulfur inside the body. And any metabolic reaction, especially we want these amino acids for the body metabolisms or for the building up of the body or any other things. So many of the amino acids like cysteine and all, it contains the sulfur. Not only the amino acids and also the saliva or even the bile juice, which helps in the metabolisms or the digestions of this fat and all, we are having this sulfur as a component. And also in the insulin, so that it helps for the metabolism of the carbohydrate. So this sulfur, it is having a huge applications in the body for the physiological process and also to correct the pathology. So coming to its usage as a medicine, for the treatment in Ayurveda, we considered there are four main pillars required for the treatment. That is Chikitsa Chatushpada. Chikitsa Chatushpada includes Bishak, Dravya, and Paricharaka and all. This Dravya plays a very important, that is the Aushadha plays a very important in the treatment aspects. So for the Aushadha, they had given the qualities. So which Aushadha is considered the best for the treatment? Even though the Vaidya himself is a very much is intelligent and is skilled to apply any medicines. But if the medicine itself is of not good, it's of no use of doing any treatment. So that's why Bahukalpam Bahugunam Sampannam Yogyam Aushadam. So that is the quality of the medicines. It should be there for any type of treatment. So you can see all the qualities of these dravyas in the Gandhaka. So it is Bahugunam, it is having the various property, it can act in different systems. So when it has been administered along with the Parada, it can act on all the system in all the Shrotas. So and also Kalpam, it can be formulated into various processes. It can be used for external applications, it can be used for internal, and in internal also in different forms, even in the liquid form, in the solid form, in the powder form, tablet form. You can make it into various forms. So that is why you can consider this Gandhaka as the best. Even it is Sampannam, it is of good quality, because when processed, it will become a good rasayana. It nourishes the body. That's why this considered this Gandhaka as a very important drug. So I titled this as an glorious drug. So here I just want to explain some of the things, like it is easy for the preparations in the home itself. So Rasaushadis means it will be having more tedious process, especially the Parada. When we want to use it, it has to be undergo different process. That is like it has to undergo the samskara, the shodhana. So it is not easy for that. It is in time consuming. It is more cost. You have to spend more money, and also that process you need a special setup to do the process of this parada and all. But that is not like that in the Gandhaka. So Gandhaka can be easily processed even in a simple kitchen setup. So whatever the medicines we prepare and we administer to the patients, that will be more effective, because in the ancient times and all, our acharyas themselves used to prepare the medicines and they used to administer to the patient. But nowadays, what is it's happening because of large demand, or because of this industrialization, these medicine preparations it had handed over to the hands of the pharmacy people. Of course, many of the pharmacy there are very good; they are preparing a good medicines, but still, when we prepare by ourselves, we can have it. We can differentiate the home food and the hotel food, because there will be care and concern. So that signifies that will have a more effective while preparing. So my intentions of this presentation is I want the doctors to prepare their own medicines. They should make their own combinations, because whatever the combination available, that may not suit each and every patient. Like the Prakriti may be wearing, because this Gandhaka, even though it is a good medicines, in the Pitta Prakriti persons are in some Pitta variations and some conditions, we have to give some counteract so that it will not having any effect. So that processing or that combinations we can make by ourselves and administer to the patient, then only we can expect a good result. Even in my personal experience also, I had seen the medicines prepared by myself and administered, the same formulations which I had prescribed outside. There is a lot of difference, even in our college, those who will do the PG research and all. So that is having a complete, that is, you can see the difference when they prepare and they administer to the patients, and whatever the same medicines from the market available drug, if they administer, there will be a difference. So I just want to, most of the physicians, because all the drugs cannot be prepared by the physician. Some they have to, so we have to rely on the pharmacy people, and some of the drugs we have to procure from outside only. But few medicines which we can prepare by ourselves, that if we prepare and administers, that will be the that we can expect a very good results. For this, you can see this Gandhaka as a very good medicines. We can prepare all those this Gandhaka formulations in our kitchen only. So that's why even I demonstrated some of the that is some pictures of this processing also has been inserted in this PPT. You can just note it. So whatever the processing we do, first we have to do the Shodhana. So this Gandhaka, after Shodhana, we can. Yes, ma'am. Okay, Gandhaka, after Shodhana, we can use it as a medicines. Unlike other drugs like Abraka, even though it is a very good drug, we have to subject that Abraka into different process. Like after Shodhana, we have to make Dhanya Abraka, then the Marana, that is Basmi Karana, then the Amruti Karana, and all the Slohiti Karana. So it is having a lot of process, and other drugs also we have to make it into Basmas, and we have so that Putta and all, we can't do it in our home. So at least few medicines like this Gandhaka, Tankana, Spatika, so those can be processed very easily. That is the Tankana and Spatika also, just by Bharjana we can purify it. Even Gandhaka is also a simple process. We can purify it in by ourselves, and we can administer to the patient. So whatever the processing we are doing, whatever the formulations we are doing, first this Gandhaka has to subject it to Shodhana. So there are different methods of Shodhana mentioned in our classics. So it is not just because they had listed many drugs, we can pick it up whichever we feel like, whichever is available, we can subject it for Shodhana. It is having a rationality behind its usage. So in which patient we are, in which conditions we are giving this drug, so that drug we have to take it, and the drug effective in that conditions we have to take it for the Shodhana. See, Shuddha Gugulu, we will just take it and process, that process Gugulu we will take and administer. But it's not like that. Gugulu Shodhana, it is of Shodhana can be done by two liquids, that it can be done Shodhana by the Kshira as well as it can be done by the Triflakwata. So Gugulu, it is having both the actions. It's having Rasayana effect as well as Lekhana. So this Gugulu purified using the Kshira, it is best indicated in for the Rasayana purpose. Whereas Gugulu Shodhana done by, because the drug itself will be boiled along with that Gugulu, and you can see the drug content also inside. So Gugulu, when it has been purified by using Triflakwata, so that can be used for the Lekhana. So this is a simple examples I have taken. That's why when we are doing the Shodhana, there are many drugs which has been mentioned, and we have to adopt that particular drug for the purpose of that drug for which we are administering. So commonly we use the Gogruta and Godugdha for the processing of the Gandhaka, because even in the any untoward effect of this Gandhaka, we can use this as an antidote. It is having antidote effect, as well as it will purify the physical impurities. So that is the process. I will explain it in the next slide. We will just see the drugs used and the method adopted. The first method is Dalana and Pachana. Dalana means you have to melt the drug. That is the Gandhaka. When heated, it will melt easily. You can take a darvi, or you can take a tawa, and you can take that kadai. You can put the that kadai should be smeared with the Gogruta. Then you put the Gandhaka. Gandhaka will melt soon, and after melting, that should be poured into the Godugdha, and Pachana has to be done. So in that boil it. So that is one method. And another easy method there, here they are not told to do any pachana, just melting and pouring it into the milk. So this is one reference. And another reference, they had mentioned Brungaraja Swarasa. Here also the same method, Dalana for 7 times, but Brungaraja Swarasa has been told this Gandhaka processed or purified with this Brungaraja Swarasa is advised to take it for the preparation of the parpati. So parpati, you know, it is specially indicated in the GI disorders. So this Gandhaka, it's having different effect over the different systems, but more effective in the skin disorders and any GI disorders. It's a good Deepaka, Pachaka as well as Rasayana. So if you are administering this Gandhaka in the case of any GI disorders, you better go to do the Shodhana along with the Brungaraja Swarasa. So if you do that with the Brungaraja Swarasa, it will be having added effect as well as it will remove the toxicity. So one more method is there, which is by Bhudara method. So that is also easy method. I'll just show it in the next slides. You can do the Shodhana in the large quantity. So this is, you can put some grams of Gandhaka, melt it and pouring it. But in kgs, you can do this Godugdha, that is Bhudara Yantra method. So one more method is there where you can get the powder of the Gandhaka. That is in the Damaru Yantra. Damaru Yantra means we can just put one pot, and in that pot we can just place the Gandhaka and place the another Gandhaka, or there's another pot over it, and inversely, and you do the Sandhi Bandhana. You just heat it. By heating, what happens? Gandhaka will melt. So this melted Gandhaka, it starts boiling and evaporating. So when evaporating, it will just go up and it will get condensed over the inner side of the upper pot. So this condensation process, you have to cover the upper pot with the cold cloth. So by this, what happens? Whatever the physical impurities will settle down. It will not go up. It will not evaporize. So only the pure Gandhaka will get and settle in the upper pot. So this will give a fine Gandhaka powder, which is easy for the assimilations, so easy absorptions. So these are some of the Shodhana method you can adopt depending upon the conditions. Like if it is for the skin diseases, it is better to go for the Gogrutha and Godugdha method of Shodhana. So this I will just demonstrate the pictures. See the first figure, it is an sulfur that I think you all know this sulfur. It is whatever the that is some drawbacks of the Rasaushadhi, whether it's a costly. So that this Gandhaka is not that costly. You can procure it for the low cost only. Or another one is it's a tedious process, but this is not of so tedious process. And you can see the some of the toxicity, especially when we use these heavy metals, but this is of less toxicity. So it is overcoming most of the drawbacks of these Rasaushadhis. So this Gandhaka can be used without much any fear of using this Rasaushadhis. So this Gandhaka, you can just take it and pound it over the Kalva Yantra, or you can just pound it like whatever the kitchen we have that pounding apparatus. You can just make it a coarse powder, not the fine powder. So that coarse powder Gandhaka, it has to be taken into the tawa, that is that kadai or any dharvi. You can just take that over the Gandhaka, and before that, better to smear with the, that's why this ghee has to be smeared means, one, of course, it is having an antidote effect, as well as it will not allow the Gandhaka to stick into that vessel. So then you heat it like sulfur, it is having a very low melting point, some 100 of about 110 degrees, it will start melting. So after melting, you just keep the vessel with the milk. You keep ready with the milk kept in the vessels, and that vessel has to be covered with a cloth. So this will separate the physical impurity. So this melted Gandhaka has to be poured poured over the cloth so that it will get filtered, and that melted Gandhaka will come and it will go and settles at the bottom of the vessel containing the milk. You can see in the figure 7 where this purified Gandhaka got settled, and take it out. You wash it with the warm water because you have to remove that snehamsha, that is milk part or that Brita part. Otherwise, it will cause, it will, if you store it for the longer time, it may cause some bad odor may come. That's why you wash it with the warm water, dry it, and powder it. So this is the simple procedure which you can do it at your home for the Gandhaka Shodhana. And this Shuddha Gandhaka can be used along with the different drugs. I will just tell it in next slides and all, how you can use it in different diseases. So this method, first you have to do it and you can store the Shuddha Gandhaka. You just pound it, heat it, and pour it into the milk using the by filtering. Then that you wash it and powder, wash it and you have to dry it. So this is a simple method of preparation of Gandhaka, the Shuddha Gandhaka, that is Gandhaka Shodhana. So another method I told, that is a Bhudara Yantra method. So you can prepare in a large quantity. You take the milk in the pot, you tie the cloth over it, powdered Gandhaka has to be poured over it, and you close with a lid, some sharava, you place the vanopalas over it, ignite it, and inside you can see the Gandhaka collected. That is the, after sometimes after burning of these vanopalas and becoming the Swanga Shitata, you just take out the vanopalas and you can see the melted Gandhaka poured inside the milk. So this is the Shuddha Gandhaka, what you can get it. So these two methods, otherwise the first method is also easy. You can just heat it and you can pour that over the milk and you can do the Shodhana and keep it for the further usage. So before usage, we should know its guna karma. So unless we are familiar with this guna karma, we are not able to adopt that into the different diseases. So the guna of this Gandhaka is Ushna Saraguna. Rasa, it is having Madura, Katu, and Tikta Rasa. Virya is Ushna Virya. That's why you should be careful while administering in the Pitta person. And Vipaka, some says is Madura and Katu, but it is most of the opine as in Katu Vipaka. That's why it is in Pitta Vardaka. And Doshagnata Vata Kapahara, but it is Pitta Vardaka. So this you should keep in mind while administering to any of the patients a dosha, then it may cause some of the untoward effects. So you should be very careful. So what are the karma it is doing is, it is a Deepana Pachana. It's very good in its GI, and also it is Vishagna. Vishagna means it is an antidote. It is an antidote for many vishas, even the Jangama vishas. It is Virya Pradatu Parada. Is Crimigna. Even in the modern medicines, we use this as an antifungal and also anti-parasitic parasitic drugs. So it's a very good Crimigna. So even the infected wound can be treated with this Gandhaka. It's a good Rasayana. So this is also very important property. You can prepare this Gandhaka Rasayana and administer for the longer durations. So this will act a very good Rasayana. It is Dirga Ayushyakara. This Drushti Shakti Vardhaka, this is also one of the important karma of that. It is good for the eyes, and also Vagdoshahara, which is a very important function. It is good in any of the skin diseases. So Prayoga, you can do it in with Sarpa, Amadosha, Vishadosha, in Krimi, Balakshaya, Mandagni, Netra Roga, Kasa, Pliha Roga. So I'm seeing in the chat box, ma'am, can you see the slides? Can you see the change in the slides, ma'am? So some have texted in the chat box saying that the slides are not changing. Can anyone of the participants reply? Is lights are changing or not?
Yes, 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 it's changing. So now we are, yeah, thank you.
Okay. Then, so whatever we just know about this Guda karma of the Gandhaka, we should be very conscious about, or very cautious while administering the amount of the Gandhaka, how much we are giving. So the dose is very important. So because even while administering in the Pitta persons, you can minimize the dose and you can administer it. So minimum of 125 mg you can start, and it can be given up to 1 gram per day in divided dosage. And Anubana is milk, even though it has been processed with the milk, it's better to advise along with the milk. And if you see any pitta, ruddhi and all, again, to the management of that, you can give this cow's milk along with the go grutta. Okay. Next, we will know how this Shuddha Gandhaka can be administered. Can this Shuddha Gandhaka can be administered alone, or it has to be mixed, like depending upon the different conditions or different diseases, we have to mix it with the different drugs to administer it. So the beauty of this Rasaushadhi is they are because of that size, or because of that nanoparticle size, it is also acting as a nano carriers. So when it has been mixed with the different drugs, it is taking that drug to the target tissues. In the Rasaushadhi, you can see the minimum amount of the drugs, like even the Trikatu or whatever we are mixing in the Rasaushadhis, it is very minimum in any of this drug, any of the tablet. Whereas when we administer the Trikatu directly, that is 3 to 5 grams, we need to administer to have an effect. So how this little amount of this drug is having an effect? Because of these drugs, which is taking even the small amount of the drug to the target tissues. So that's why any of these medicines, like you can administer regularly, you may be administering some of the herbal drugs. So along with that, you can add some of the drugs, like even you can add some abrika basma. So if you are knowing about the pharmacy genine where drugs are available, you can just procure the basma, or even if the patients are affordable, even swarna basma can also be added to that. So in such cases, the effect will be miraculous. You can see the more effect even with the simple preparations when added with these basmas, the abrika basma, swarna basma. Even this Shuddha Gandhaka will add the same. It will carry the drug what we are mixing to the target organ. So one thing we can do, because it is a very good, not only in the skin diseases, even applied over the painful area, that will minimizes or reduces the pain. So externally, you can use Shuddha Gandhaka Lepa in case of Amavata and also in the case of Vrudrasi over the affected area. So where the pain is more seen, in that area, you can apply this Shuddha Gandhaka Lepa. Otherwise, if you are applying with some other chunas, like it may be the Dashanga Lepa, Rasna Chuna, whatever you are mixing, you just mix Shuddha Gandhaka to that and you just apply it. So you can see the difference in your treatment. You can see the difference in your result. So even in the Agni Mandya and Jatrudva Rogas, especially the eye disorders, if Shuddha Gandhaka is administered along with the Trifala Kvata, so it will be a good result. In case of Kasa and Shvasa, so like Kandakari Kashaya will be effective. If this Kandakashakari Kashaya, it can be given as an Anupana to the Shuddha Gandhaka. Otherwise, this Shuddha Gandhaka can be mixed with this Kandakari Kashaya and can be advised to the patient can be advised to take. In such a cases, even this Kasa and Shvasa will be having a very good result. If you are not giving any drug, but we have to administer Shuddha Gandhaka, that powder patient, because it is having some smell, even though after Shodhana, the Gandhaka, the word itself is because of its Gandha. So it is not of so favorable. If the patient don't want to take that, like it is not so convenient for the patient to take that. So in such a cases, it can be advised along with the banana. That banana in
मैम
under the
पीपीटी आगे नहीं जा रही, स्लाइड चेंज नहीं हो रही अनुरूपा जी,
not changing, ma'am.
स्लाइड चेंज नहीं हो रही शायद ना. हाँ ओके मैम,
So I-
ओके ओके, यस यस, हाँ ठीक है.
Okay. So this Gandhaka can be administered along with the banana, if not like any drug if you are mixing. Otherwise, it can be mixed with different drugs in different Tvak rogas. If it is a Dadru, in case of Dadru, this Shuddha Gandhaka can be mixed with the Shuddha Tankana. As I told, this Shuddha Tankana, Shuddha Spatika, it's also easy for the preparations. You can just try it. Bharjana will make this Tankana and Spatika Shuddha, and any of you are using it externally. So you need not be more cautious about its perfectness, whether the Shuddhana has been done correctly or not. It will not produce more, not any side effects when applied over the skin. This, but you can do some Bharjana till that water content evaporate in the Tankana or the Spatika. So that is also easily available in all the Pansari shops and all. You can get it easily, this Tankana and Spatika. If you mix all these Shuddha Gandhaka, Shuddha Tankana and Shuddha Spatika along with the Shala, and you apply with the Nimbu Rasa, so this will have a very good result in the Dadru. In skin disease also, if you are having this Pama, this Shuddha Gandhaka can be mixed with the Mrudara Shunga. So Mrudara Shunga is also available. So that Shodhana is easy. You just do some trituration with the water. So here the water, why means to make it fine powder. So that too, when we are applying externally, no need of doing any Shodhana. You can use this Mrudara Shunga along with the Tankana and Karpura. If you mix all these combinations, all these drugs, so in the equal quantity, you should mix all this. And if you apply along with the coconut oil, so that would be having a very good result in the Pama. So, and in Mahakushta, so internally this has been administered because this Shuddha Gandhaka, it works good in Kushta, both you have to use it both internally and externally. Internally, it acts like a Rakta Shodhaka, and also it will remove the toxicity and helps in curing the skin diseases, as well as so external applications will also have a local effect to cure the skin diseases. In this Shuddha Gandhaka along with the Amalaki, Swarasa and Madhu, this has been advised to take internally. And in Mandagni and Ajirna, this Shuddha Gandhaka can be advised along with the Haritaki and Triphala, Kashaya. And even in the Netra Roga, this Triphala Churna, it is it's having a very good effect over all type of eye disorders. So Shuddha Gandhaka, if it has been mixed with the Triphala Churna along with the Madhu and with the unequal proportion, you can mix it and advise in any type of the eye disorders. And even it is having a good result in Buddha Roga, but you have to mix this Shuddha Gandhaka with Tila Churna, Eshti, Swarnapatri, and also Mishreya. Tila Churna or Eshti, any one, one can be used along with the Swarnapatri and Mishreya. So this will be having a good result in the Buddha Rogas. So these are some of the formulations or preparations, simple combinations you can make with the Shuddha Gandhaka. So this Shuddha Gandhaka can be used in other formulations. That is, Gandhaka can be taken to prepare other formulations. So this is also easy preparations. You can prepare it in home only. We regularly do it in our college. So here also we have to take the Shuddha Gandhaka. So that's why whatever the Shodhana we are doing, if we do it in the large scale, and we can keep it and we can use it for any other preparation. This Gandhaka, 16 parts of Gandhaka has to be mixed with 1 part of the Chikatu Churna. So you just mix it in Kalva Yantra so that it will become an uniform mixture, and that mixture has to be spreaded over a cloth. So one cloth you have to take, which is of the that is a dimension of this 1 foot, that is the length and the breadth of 1 foot. Over that cloth, you have to spread that mixture, and you have to roll that that is the cloth into a type of wick, and you have to tie it with a thread so that this Gandhaka will not come out. and that has to be soaked in a tilataila for 3 hours. After 3 hours, you take out that wick and ignite it, and that's what I shown in the picture. You just ignite it, and at the burning end, you can see the druti collecting from that burning end. You can collect it with the vessel and you can use it. Even this Gandhaka druti, it's available market in the market, but that is available nowadays. So before and all, it's not much. That is not much pharmacies they were preparing this. And this isn't so easy preparations. You can just prepare it at home, and it is also having a very good results both for the internal and external usage. I think you got that procedure. 16 parts of this Shuddha Gandhaka mixed with the 1 part of this Trikatu Churna. You mix it in an Kalva Yantra so that it will become an uniform mixture. And that cloth, what you had, one cloth has to be taken with 1 foot of length and breadth. And over that cloth, you spread it uniformly, this mixture, and you turn it, you roll that cloth into a wick shape. You make it like a batti. And that you have to tie it with a thread so that this content will not come out, and tie it with the thread and soak it in an oil, tilataila, for 3 hours. After 3 hours, you take it, you hold that one end with an sandamsha yantra and ignite it from the other end, and that burning end will use the drops which is collected as a Gandhaka druti. So how to administer this druti? Of course, you can use it externally for the any type of this kushta. External applications can be done. So it can also taken internally. That is, the 3 drops of this Gandhaka druti has to be mixed with 1 valla of Shuddha Parada. So this Shuddha Parada is not available. You can just take these 3 drops of this Gandhaka druti along with the Nagavalli Patra. Over this Nagavalli, the betel leaves, you can drop those 3 drops, and you can fold that Nagavalli Patra and just take as how you eat this betel leaves. So this will be very good in even in the Kushta, Kshaya, Pandu, Kasa, Shula, and all the GI disorders, all the Ama doshas, this will work good. So another preparation is there, Gandhaka Rasayana. Here this Gandhaka Rasayana, you can make it in the powder form or in the tablet form. In the market, this tablet form is available. So those who have very patients can go for these preparations. Otherwise, they can just procure from the market or from any of these pharmacies, because this has to subject to many bhavanas. So that is only the problem. Otherwise, this is also an easy preparations, only bhavana. There is no other preparations. So this bhavana can be given in the grinder also. You can just put that powder of the Gandhaka in the grinder and you add the Godugdha, so that it will be completely immersed, and you on the grinder. So allow that to completely get dries up, that water content or Godugdha part get dries up. So that will become 1 bhavana. So the same procedure has to be repeated for 3 times. So the 3 bhavana of this Godugdha will happen. And again, 8 bhavana in each drug. So this is the problem for the preparation in the home. But those who are really interested and are having good patience, they can go for this preparation. Twakwata, Elahima, Tejapatra Kwata, Nagakesara Kwata, Guruchi Kwata, Haritaki Kwata, Vibhitaki Kwata, Amalaki Kwata, Shunti Kwata, and Drungaraja Sarasa. So these drugs has to be procured, and in each drava, in each liquid, 8 bhavanas has to be given. That is, the 1 bhavana has to be repeated for 8 times. So that is 8 times in Twakwata, and again 8 times in Elahima, again 8 times in Tejapatra Kwata. So likewise, this has to be repeatedly subjected for the bhavana, this the Shuddha Gandhaka. Then the final content, what we are getting, that equal parts should be mixed with the Sharkara, with the sugar, and you can store it like an Gandhaka Rasayana. Otherwise, that final product can made it into tablet, which can be rolled into a tablet, and you can use it. In the market also, this tablets, Gandhaka Rasayana tablets are available. So this has to be administered 1 karsha, that is the 12 grams, if you keep it in the form of powder that has been mixed with the sugar. So it can be given in a larger quantity, 1 karsha per day. So in divided dose, not in a single time, or Arohana Krama. Arohana Krama, that is, you start with the 1 gram. Then the second day, this 2 grams, like that. The maximum of 1 karsha, 12 grams you can go, and again you can reduce it. Reduce it and come to the 1 gram. Arohana, it's the Vardhamana Pipali and other rasayanas out we are administering like that. Even this Gandhaka rasayana, which has been processed with so many drugs, can be administered starting from the minimum dose and go up to the 12 grams, and it can be reduced. So this is a very good for rasayana purpose. Otherwise, we had made the tablet, and the market available tablet also can be given 1 to 2 pills. Each pill will be weighing about 250 to 300 mg. So that 1 or 2 pills can be given 2 to 3 times a day. So this is a good rasayana. It is pushtikara, balakara as well as deepaka. So this can be administered in all types of prameha. In prameha also it can be given, even the kushta or even GI disorders. And this is good in all types of Kushta also, Gandhaka Rasayana. So another, the last preparations I will just do it, tell it. So this is also an easy preparations which you can prepare in it and home. Gandhakadya Malahara. So all this we discussed about this internal administrations. This is an Malahara. So even though we can just apply the lepa over it, Malahara will contain a proper base which will keep the drug in in the site, that the required site, it will be kept, and also it will help to that is the induce inside the skin. It is passed through the skin for the better absorption. So if it is in the ointment form, that will be a more effective. So Gandhakadya Malahara. So Gandhakadya Malahara, it contains Sikta Taila. So you know Sikta Taila, 1:5 parts or 1:6 parts of the Sikta. Sikta is the beeswax and Tila Taila, or you can also use Narikela Taila. Now, coconut oil is also good for the skin diseases and all. So 1 part of the Sikta beeswax, it's also available in the market. You can just take it. 1 part of this beeswax melted. After melting, you have to filter it so that any dust part or any, that is some of the leaves, sticks should not get into that. You just filter it, and to that you mix the 5 parts or 6 parts of the coconut oil or the Tila Taila. You mix it, you stir it so that it becomes uniform mixture and allow for cooling. After that, it will become an like what it has been shown in the picture, like that it will become like a base, ointment base. So this alone can also be used. We use this white ointment regularly. So that only we will mix some Haridra Churna to this Sikta Taila. So it is also very good result, but not for some infected or serious conditions. The simple like foot cracks and all, it is a very good, having very good result, this Sikta Taila. So Gandhakadya Malahara, when you are preparing this Sikta Taila base, has to heat it so that it will melt. So after melting, you can add all these ingredients, stir it and allow for cooling. So that is allow for cooling, it will become an ointment. So what are these ingredients? Means in that proportion only we have to add Shuddha Gandhaka, Shuddha Girisindra. Girisindra is also, that Shodhana has been not mentioned. That is for external, it's no need. Shuddha Tankana. Tankana, you can take it and you can just fry it. Karpura. So all these drugs, you can just make it a fine powder and keep it aside. After melting of this Sikta Taila, you add all these mixture and stir it. After stirring, it will allow for sometimes, like you have to put off the stove, allow for some time, it will cool down and it will become like an ointment, which has been shown in the upper picture. So this Gandhakadya Malahara can be administered in various skin disorders for the external application only. So another one, same thing, that is Dadru Vidravana Malahara is there. This is also, you can do it in home only. Sikta Taila base, you have to melt it. You add Shuddha Gandhaka, Shuddha Tankana, Chakramarda Bija Churna and Laksha Churna. Only thing is the powder should be very fine, so that it is easy for the applications and it is easy for the absorption also. So this fine powder should be mixed with this Sikta Taila, and you mix it thoroughly and allow for cooling. It will become ointment. So you can administer, you can pack it in small box and you can give it to your patients. So when this has been prepared by you and administered, you just see the difference in the results. And that I promise this will have a very good result. If you prepare this Gandhakadya Malahara, Dadru Vidravana Malahara, will have a very good result when compared to the market available preparations. So these preparations are easy, means why can't we just go and prepare it, and why we have to depend? So this is also very cost effective. When you prepare it in a home, you can dispense for the low price also, and the quality is also good. So that's why I stress that you better do it by yourself, or at least the simple preparations you can do it. So Gandhaka Taila, it's there, but it is of not much usage. It's better to use some many references are there. Gandhaka Taila is nothing but the Gandhaka Dhruti only. But there is one reference, but I have not tried this. I'm just taking it the reference, and those who are interested then can do it. Just boil the milk, you add the Shuddha Gandhaka powder. You boil it so that it will become condensed. Then do the mantana, take out the butter, and while heating that butter, you can see the supernated taila part, liquid part, which is collecting, and that is used as a Gandhaka taila. But don't get confused. Gandha taila is same as Gandhaka taila. Gandha taila is completely different, which is a bone strengthener. In many other conditions, we use this Gandha taila. So this Gandhaka taila or this Gandhaka dhruti can also administered internally, that is in the drops, 2 to 3 drops along with the milk. Otherwise, it can be used externally. So these are the some of the formulations which the Gandhaka can be used. The very important thing is Shuddha Gandhaka. Shuddha Gandhaka can be given with different powders, different drugs in various diseases. Otherwise, you can make the Gandhaka Dhruti and administer, which will remain as a liquid form only. Otherwise, you can make it as an ointment form, that is the Malahara. Different combinations will give. It's not only you have to add these drugs for the preparation of the Malahara, depending upon the conditions. If you see the pus oozing out, or if you see some discharges, if you want to do that Ropana, you can add even Panchavalkala Churna. Like many, as your wish, you can add different drugs. That's a fine powder of that drugs, and you can prepare the ointment, but add the Shuddha Gandhaka, so it will be having more effect. And it will give a very good result. So while administering internally, this also has to take care, that is Patya. So what Patyas is more advised is Jangala Pashu Pakshi Mamsa, Aja Mamsa. It should be, it should not go for the Anupa. Jangala Pashu Pakshi Mamsa can be given, and the cow's milk, that is the Gogruta and Gokshira, along with the rice. So this is considered as an Patya. Apatya means, as it is a Pitta Vardaka, better to avoid all this Chara, Amla, Atilavana, Katu, Vidayi Ahara, and green vegetables, even the dicotyledons, Sri Sevana and Yana. So if it is not followed strictly also, especially in the Arohana Krama, when you are giving in the more dosage, this has to be followed. Otherwise, if it is in the lower dosage, you better advise not to take off more of Pitta Vardaka Ahara, and advise more to take off this Gokshira and Gogruta. So that is enough, this Patya. So this will come to end of my presentations, but still, if you have any other discussions, if you want to add up any your own experience, otherwise, if you have any doubts, you can just ask any questions. Thank you.
Thank you, ma'am. Thank you very much. Very nice. Thank you. Any questions? मैडम आप देख सकती है चैट बॉक्स में? हाँ प्लीज. कॉन्स्टिपेटेड चाइल्ड कैन गिव गंधक रसायन दे सकते हैं, कैसे पूछा है मैम? अनम्यूट करके डायरेक्ट पूछिए ना डॉक्टर प्रियंका जी, तो बेहतर रहेगा.
Okay. Like constipated child can also be given Gandhaka Rasayana, but it should be given along with the milk, because milk is also an laxative. You can advise Gandhaka, madam, no problem. Gandhaka Rasayana can be advised.
Ma'am, I have heard long-term use increases weight. So is it true? Can we give an obese patient or like that?
No, ma'am, no such like if the obesity may be due to some other reasons, not due to the Gandhaka. Gandhaka will not increase the weight. And the only thing is they should follow some of the Patyas. Along with the diet, if they give this Gandhaka, because long-term use, how many days they can take? They can take up to 2 to 3 months. So after that, they can have a break and again they can start. So this is a Rasayana drug, can are they have to administer for the longer durations. In the shorter durations, you can't see that rasayana effect.
Okay, so it doesn't increase weight that much, like, because you said it is balle, pushtikar, all go dukh and go grit bhavit. So I thought, I have heard that it increase weight.
No, ma'am. Actually, it is advised in Kshaya and all, because in Kshaya cases, how this Pushtikara is happening is because of the some metabolic disorders, they will be having this Kshaya. So it will correct the metabolisms and it helps for the Pushtikara and Balakara. And this obesity is also it is also one of the metabolic disorders, and it will correct these metabolisms, and in turn it will not increases any weight.
Okay, ma'am. Thank you, ma'am.
That the formulations explained for Dadru, Shuddha Gandhaka, Tankana, Shala, Spatika, Nimburasa. So the ratio is equal quantity, madam. It's not for internal administration, it's only for the external application in Dadru.
Ma'am, what is Shala in that? Shala is what?
Shala is that is the resin, ma'am.
Resin.
Yeah.
Okay. This गोंद जो बोलते हैं वो या फिर जो मनुष्य के.
Ma'am, can you tell about Gandhak Druti? Some information about.
So Gandhaka Druti, it can be advised along in the form of drops. It will remain as an liquid only. So 2 to 3 drops, madam. It can be used internally. If you are giving.
And local application. What about local application?
Can also give advice for the local application also. In such cases, you can apply over the affected area in the required quantity.
Okay, ma'am.
Like
ma'am, if in any case अगर कोई complication आ जाता है या any type of irritation, so what will be preferred? What will be the line of treatment for such cases?
Apply the Gogruta over it, madam. It will pacify that. And internally means they can have that is the kshira, they can just have it, milk. So even one more thing is those who are having sulfur allergy patients. So on observations, even in such patients also we can advise the Gandhaka. But the patient should be on observation only, so that the condition should not become so serious.
Any specific Gandhak, there is any specific form or like market may how we can get it?
Madam, in the shop, in all these pansari shops and all where we get these drugs, the mineral drugs and even herbal drugs, there we can get this Gandhaka, madam. That is the Ashuddha Gandhaka. That can be taken and paid. We can do the Shodhana by ourselves. Otherwise, Shuddha Gandhaka is also market available, but that will be done in the pack. They will give it, but that will be more cost. So that other than that, you can just get it from the from those stores, and you can do the Shodhana. That will be that is the cheaper and more effective, I feel.
Okay, ma'am. Okay. Anything else, doctors? Any specific questions from your side?
मैम वंस आई शोधन किया था मैंने, बट उसके बाद भी एक तो बहुत तीक्ष्ण उसमें गंध थी, और थोड़ा सा जब दिया किसी पेशेंट को तो उसमें चक्कर आने की उसने कंप्लेन की, तो क्या शुद्ध नहीं हुआ प्रॉपर या उसको पित्त वाले लक्षण थे? बिकॉज ऑफ दैट ये प्रॉब्लम आई.
Like the problem is actually to make it completely nirgandha, it has been advised to do 100 times of dalana. So it has been told in classics only 100 times you have to repeat the process so that it will become nirgandha. So if the gandha will remain, that is, you have to do at least 3 times of this dalana process. Dalana means melting and pouring. Have you done that, ma'am, or only one time?
Yeah, I have done only one time. So
one time. So 3 times you have to do that.
Okay, ma'am. Thank you.
Yes, given that Brahma and all, it is due to Pitta Ruddhi only. You have to give along with this Anupana, along with the Kshira. Shuddha Gandhaka should be given with the Kshira so that it will nullifies if there is any Pitta increase. And you have to first assess the patient Prakriti and disease and all. If they are Pitta Prakriti person, give it in the less dose along with the Kshira and Gruta. Otherwise, it can be advised in the bit more dose, but it's better to advise all the patient the Shuddha Gandhaka along with the Kshira.
Okay,
And
ma'am.
Shodhana has done Dalanath process 3 times, ma'am.
मैम
But
एक
even
क्वेश्चन था ये गंधक रसायन के बारे में, लाइक फॉर आरोहण कर्मा, आपने इसका
Madam?
जवाब दिया आंसर? गंधक
What
रसायन
is it?
मैक्सिमम डोज के बारे में?
Maximum 12 grams for Arohana Karma. So from how much dose? That is from the 1 gram. It should start from 1 gram and increase every day with 1 gram. 2, 3, 4, 5, 6, like that 12 grams. Then you reduce it again the same. 11, 10. So this, in this condition, in giving this Arohana Krama, strict Patti has to be followed. So whatever
how long it can be
you
used?
are giving,
Any Gandhakalpa, how long it can be used?
it can be used for rasayana and also in very chronic skin disease condition.
Okay, okay, ma'am. Okay.
Ma'am, what is that? May we use Gandhaka Dhruti along with the coconut oil or other combinations? But that itself, Gandhaka Dhruti itself is in the liquid form. So better not to use all this coconut oil or any other thing so that it will get diluted. You can use the plain Gandhaka Dhruti for the application.
Okay, ma'am. Okay. Thank you very much. Thank you very much. So I think there are no such questions. So thank you very much, ma'am. Very nice session. And I would like to congratulate you for your information and cooperation. Thank you very much. तो आज के लिए रुके हम लोग, सभी डॉक्टर्स का भी मैं आभार व्यक्त करती हूँ जो लोग हमारे साथ यहाँ पे जुड़े हैं। और ये हमारा पहला सत्र था। नेक्स्ट सत्र होगा हमारा संडे को, जो कि बहुत ही एक एक्सक्लूसिव होगा यूरिनरी सिस्टम को लेकर, आयुर्वेद के हिसाब से मूत्रकुच्छ रोग में किस प्रकार से हम लोग काम कर सकते हैं, ब्रॉड स्पेक्ट्रम व्यू विथ यूरिनरी सिस्टम। सो थैंक यू वेरी मच ऑल द डॉक्टर्स। ओके मैम, shall we conclude? Yeah, thank you. Nice. Thank you.